In 1984, Chandres and Buchov propounded one of the most popular theory of ethics. And this theory of ethics is applicable to all fields of human endeavor and much more applicable to biomedical research involving human participants or generally in healthcare ethics. One of the principles is principle of beneficence, which means every action you are going to take about a patient or research participants or participant in research generally, it must be of benefit to that particular participant or patient. That means you have to apply kindness, charity, goodness, compassion, empathy, sympathy, etc. as far as that principle is concerned when dealing with human participant, patient, or research participant, or any action you intend to take. The second principle is that of principle of non-maleficence, which means least harm. In every action, you must not harm patient or any other person that you will be involved with or the person will involve in your research, medical procedure, treatment, or even business. You must not harm that particular person, or at least if there will be a minimum harm, then it must be the least harm. It must be very minimum, and even that must be inevitable harm. For instance, even too much taking of water can cause harm, too much eating can cause harm, injection can cause pain, drugs can have side effects, surgery may have side effects, but the probable risk must not outweigh the benefit, and there must be probably alternative that will avoid that particular harm. The next principle is principle of justice. Justice means fairness, equality, equity. Fairness, you have to show due consideration, you have to be fair. Equality, you should not discriminate. You should treat people equally, but it's not everyone that should be treated equally, because there are some that are physically challenged, or pregnant women, or elderly, or the children. So in that kind of situation, they need equity, so that they should access healthcare services, surgery, operation, or function equal to that of a normal person. Then you also not pick some people for research because they are maybe prisoners, or they are psychiatric, or they are poor. No, you have to be just and equitable and equal in this particular context. Then the final one is principle of autonomy. Principle of autonomy is also referred to as principle of respect for person, because human being is a very dignified person, is a creation of the God, and you must respect him. You must ascertain or consider his own fundamental human rights granted to him by the Constitution and also Universal Declaration of Human Rights of the United Nations. You have to consider the fact that he is autonomous person, he is independent, he has rights and principles which must be respected. This can be applied to healthcare. In terms of surgery, you must have his consent. In terms of not needing any treatment, you must respect his wish to be discharged, even if against medical advice, so as to avoid false imprisonment or violation of human rights or privileges of the patient. When we look at the Universal Declaration of Human Rights of the United Nations, fundamental human rights of the patient bills of rights, we may add knowledge on these aspects. Thank you for your attention. I appreciate your time and good listening. Bye bye.